So how do you protect your hands? Again, if you have intact skin, if you didn't have cuts and scrapes, etc., of course, one thing, don't work on your motorcycle on the weekend. That'll tear up your hands, and because your skin is a great barrier. And we know that gloves aren't perfect. So intact skin is a very important barrier. That's why consider using hand hygiene products that have aloe vera or some type of emollient in. Allow the hands to thoroughly dry before donning gloves. Use hand lotions as part of your protocol. This is the hand lotion we have in our practice. Again, this is a Clorox product. What I like about it is, again, the over-the-counter products are not necessarily designed for dental offices. They can have petroleum byproducts in there that can break down our latex gloves. That's why, again, if you're going to have a hand lotion in the office, and I highly suggest it, because even with good soaps, even with good alcohol-based hand rubs, you will get some dryness. Make sure it's a professional product like this. These are the products that I have in my office: the hand cream, the alcohol-based hand rub, and the actually antimicrobial soap. I mean, it's really, you need to have all of these things available to keep healthy hands. Storage. This is really interesting. You may have heard this, you probably have, but refillable soap containers can harbor all kinds of bacteria, and it's because of biofilms. I mean, you would never think that bacteria, how could bacteria live in disinfecting soap or alcohol-based hand rub containers? But they can. So what's really important is this. Of course, follow the manufacturer's recommendations. I always say that for storage and refilling, but the basic thing is this. When you're refilling containers, don't just keep topping them off. There's a tendency to do that in the dental office. I know it's kind of those bad habits we get into, not washing hands between patients, counting on the gloves. Well, another thing is you keep topping off these soap containers. What you need to do is either have a sealed refill, like you see here on the right, on the lower right, or when you're refilling your containers, do what we do. They get down low, we rinse them out, we turn them upside down, we let them dry. You need to let them dry out to get rid of those biofilms. Nothing will kill a biofilm better than desiccation.